Okay, back to our story, our trilogy. So it is now 1990. I've been at Hopkins for a couple of years. I also had our son Alex in the interim. And Dean is finished 3 years of being with this group practice. And as he mentioned, it was a grueling 3 years for him. And, we decided that he needed to go off and become a solo practice plastic surgeon. So at that point, we decided that I would leave Hopkins so that I could temporarily help him open an office, get him off the ground, and then I could go back to Hopkins. Well,
Things
30,
are always
30
a
years
little
later,
different.
we're still here. I'm still here. And that's how we got started working together.
So I became board certified during that period of time and went back to working for myself. We obviously moved into a solo practice office, and at that point started developing more of a breast reconstruction practice. I continued to see lots of trauma and pressure sores and other difficult reconstructive options. I realized at that time that plastic surgeons are super creative people, but they generally take tissue from one part of the body and put it onto another part of the body. Or they grow tissue in one part of the body in order to cover another injured part of the body. And when I took that to the next level, I thought it was better to be able to provide for my patients a more institute type practice for wounds. And Lori and I proceeded to Northwest Hospital and offered them an opportunity to create a wound center.
So I want to interject about him because he's written chapters and books about wound healing. He used to heal the kind of ulcers, diabetic ulcers, that most doctors couldn't heal. And he did it because he had a full anti-aging approach to his wound healing. He really understood the patient as a whole, their nutrition, the quality of what was happening with their health. So he never just saw the wound as a wound. He actually saw the wound as a very complex person and how he treated the person
and
with nutrition.
A chronically ill patient that needed much more factors involved. So it could have included nutrition and hormones and minerals and care from the outside and so forth. Long story short, that's what developed my idea about the physiology of rejuvenation and anti-aging.
And skin.
And skin.
Yes.
So I had the opportunity to see Dr. Obagi give one of his first lectures. And I thought to myself, here's a guy that truly understands how to change chronically old, sleepy, tired skin into more rejuvenated, healthy skin. That got me thinking, got me involved with Dr. Obagi and many of the initial people in the 90s to thinking about physiologic anti-aging. What I coined at that time, and we actually talked about, called cosmetic medicine. I finished up with anti-aging medicine and got a second degree in that. And about the year 2000, I was even providing hormone therapy for patients with bioidentical hormones. It really helps. The problem is, of course, is that you've got a different type of medicine going on, and I love surgery. I love the creativity of surgery. Lori was really improving our skincare options with Dr. Obagi's philosophy.
Okay, so this is going to go on to part 3. So those people who are getting bored with us so far, we will stop here, give you a timeout, and we'll tell you about how we got involved with Dr. Obagi.
And then some more.